Hello, my name is Gabriel Ruan, and my public health topic will be on syphilis. Syphilis is a sexually transmitted infection that is spread through a bacteria. So, why does this public health problem still exist in our society today? Well, syphilis occurs on the bacterial level, which means that it's nearly impossible to eradicate completely. In the US alone, there are around 30,000 cases. And one of the big factors that contribute to why syphilis is still around today is unprotected sex. So, how does this disease happen? Well, it's caused by a bacteria called Treponema pallidum. This bacteria is what spreads during unprotected sex or during pregnancy from a mother to her child. There are four stages associated with syphilis. In the primary stage, there are visible sores around the genitals or the rectum area. They could also be around the mouth and lips. The amount of sores on the body differs from patient to patient. In the secondary stage, there are visible rashes all around the body. It can also be combined with high fevers and lymph nodes. In the latent stage, there are no symptoms. This is a dangerous stage because patients often go years without being treated because they are not experiencing any symptoms of this disease. Tertiary syphilis is the extreme result of the infection. Individuals who suffer from this stage experience severe medical problems that can affect their entire body. When syphilis spreads to the nervous system, it's called neurosyphilis, and when it goes to the eyes, it's called ocular syphilis. Neurosyphilis can include a paralysis, numbness, dementia, and ocular syphilis can result in blindness. So, where does this disease happen? Well, it's a global disease. It occurs anywhere in the globe, and there's rumors that it had originated in the Americas in the New World during the time of Columbus. So, as far as the future community risks, the disease will never be eradicated, so as long as people are still engaging in unsafe sex practices, there will still be a likelihood that they could get STDs such as syphilis. Interventions such as condom usage and antibiotics are things that can lessen the risks for the future community when it comes to the spread of sexually transmitted diseases. Most common population for syphilis is men in their 20s and 30s. You can also contract the disease more than once. Just because you got syphilis and you got the cure for it does not mean that you cannot contract it again. You can in fact contract it multiple times. This is the unfortunate reality of this STI. There is no known way to gain full immunity from this disease. We can only hope that with future research, we can find some sort of cure that also builds a permanent immunity. So, how to solve this public health problem? Like I said before, we cannot eradicate syphilis completely from the world, but there has been antibiotics that have been successful in eradicating it from people's immune system. So, one helpful public health strategy that is used to combat syphilis is the antibiotic penicillin. This drug is known to cure the disease completely. Another public health strategy to combat this disease is proposed through the CDC. They have the CARS project, which is a project where people are educating communities about safe sex practices and sex in general. And they are also providing services such as STD screenings. They're available every day of the week, and it is a wonderful tool in our modern era to combat STDs. So, when it comes to the scientific literature on preventing syphilis, similar to other sexually transmitted infections, safe sex practices such as condom usage are the best ways to prevent these diseases other than abstinence completely. In my opinion, I think that there needs to be more sex education curriculums within middle schools and high schools. It's not enough to just have one class in all 4 years of high school or maybe a health class in college to fully understand the dangers and complexities of these diseases. I think we should also be educated on what resources are out there for us to get things like STD screenings. These tools are very useful in creating a future society with a lot less STDs and an overall healthier society.